Miss M Foundation is a non-governmental organization that is extending humanitarian gesture across states in Nigeria, including the Niger state, where the program was flagged off in Bidda. The program officer for the Miss M Foundation, Esther Chukuma, stated that the initiative has been launched in Abuja, the Federal Capital Territory, Nasarawa, Lagos, and now in Niger state, where 280 women were to benefit. She said the program, organized in Bidda, was to commemorate World Women's Day with a focus on providing free basic medical services to the selected women. Esther Chukuma further explained that the program aims to address issues related to self-medication and drug abuse, which she noted are prevalent among Nigerians.
I said the insurance covers for 1 year. Okay? It will see how you respond to going to the hospital and receiving your basic services. We will get a report from the insurance company. When we see the response, that will encourage us to maybe renew. But we are not promising you that we are going to renew after 1 year. But there is probability that we will renew when we see the response.
The program officer and other speakers also took the opportunity to express appreciation to the founder and sponsor.
Honestly speaking, it is a great opportunity to us in Niger State, especially Bida, particularly because this Empowering Women's Health initiative is a program that people have been bringing it on the side of other, but I think this one is one of the best and I see so far. Because we have our women here, we have less privilege, and widows that are here that they cannot be able to have the money to buy drugs. So with this health insurance scheme, it will make those who are in this problem to solve whatever they want to do.
Officials of the Miss M Foundation also paid special homage to the Etsunupe and Chairman Niger State Council of Traditional Rulers, Yaya Abubakar, at the Wadata Palace Bidda, where the Etsunupe blessed the foundation and prayed for further blessings. Some of the beneficiaries also have this to say.
Okay, good morning everyone. My name is Joyce Ime. I'm a representative of AXA Mansard, and I'll be speaking to you today on your health benefits. Your health benefits that has been purchased by the Miss Maina Foundation on behalf of you. So I'm just going to speak through the benefits and what you will enjoy on this health insurance. So this health insurance will cover you in Nigeria, and there's an annual limit of up to ₦1 million. This benefit covers you for outpatient care, general and specialist consultation. So in the event that you need to see a specialist, the plan will cover you in that case. This plan covers you for prescribed medication and also management of chronic condition. Management of chronic condition speaks to people who are taking medication for hypertension, diabetes, and the likes. Those chronic conditions that require you to take medication on a monthly basis, up to 50,000 naira. For diagnostic care, the plan will cover you, provided this is recommended by
Orlando X-ray ji asibiti wannan wannan cover X-ray ne da yanda ci na ba da X-ray ya ne na ke aka ke test sai ga ke actinography no tuina aga kaya wai doctor ci aka kaya wai ga da ji bincike ga mushi wannan da wannan ga mushi ba ta cover amma dole sai na doctor ga kana an ga ya ne
meaning that this is not covered based on self-request. Laboratory services, including hematological investigations, microbiological investigations, and chemistry investigations, are all covered on the plan.
But the doctor has to tell you to go and do the test. Remember, we are trying to.
The test in the Monga, Wakaka, which allow both the laboratory.
Are recommended by the doctor. Advanced investigations and complex investigations like echograms, CT scan, and MRI will not be covered on this plan. Hematological investigations, microbiological investigations, and chemistry investigations are all covered on the plan as recommended by the doctor. Advanced investigations and complex investigations like echograms, CT scan, and MRI will not be covered on this plan.
CT scan, machine the
reason is because this insurance is basic health care insurance. Basic. It's called basic. That is why it's not covering complex health matters. MRI is required when someone has spinal cord injury, major injury as a result of accident, or the person has cancer. Those are very complex issues. Okay, but we are hoping that as we go on with insurance and we get more sponsorship, we can increase the level. But this is a growth plan, so it is specifically basic.
Insurance now, and I go to go and I jite mobuna I don't go. I get Urugudo ga tsanani ano nga yi na yi la kaku na amma ba ta da tsanani ya ga ji brain scanning shi no ko kuma ga za ban tukun zuma ya ni ga ajin a lotun ji yi no ba ala je kago tun ba wuce ba amma lokaci beje na ga beje zalaji more support zalaji za wo ni ja support ya ga za ko ta to ba ji taimako wuce shi
Peradventure, someone needs to have a physiotherapy appliance like crutches, collar, cervical collar, and all those neck collar. This is not covered on this plan. However, if the person has to have physiotherapy sessions, we will cover this up to 5 times in the year.
Mbechu ga ezabete batina yitsanani na ga kwa la tukuna ko kuma la ngo china shi la kun ko wani da ai ko bayan muci bata ala kun ba muci ja so ai ko bayan muci ja.
But if the person needs physiotherapy, we will cover up to 5 times in a year. You know what physiotherapy is?
Yes.
Yeah, so explain.
Ama aga de deseji ki ajan aye ba jugwani na ai lawo ai jinte mo ko ti da ki arzu gutu na ama wache lo frequently bo alo ina da do agon yojin da in the next 2 weeks kwa go vision the next a month ani wa jun ari aye ju ko kre mu chari da arzu gutu.
For obstetric and gynecologists, for those people that are pregnant and need to deliver, the plan will cover up to 100,000. That
wọ́n jí tíì náà èyí àìlò plánù kọ́kọ́ wà á di 100,000 owó dùgbò tàrí àti tẹ̀mọ́kú náà àti tẹ̀mọ́kú àti dùgbò tàrí ní wọ́n jí tíì.
If a woman is pregnant, the plan will cover for and up to 100,000. You will cover, you will enjoy your pregnant until your delivery, and even if you're in admission, it will cover it up to 100,000 naira.
Nga kuchiri arbi ebe no je wona arbi kami no amogi no da eti wona yibubo dari no.
there's antenatal, induction of labor, assisted delivery, postnatal care, family planning. All of that will cover up to 100,000. If your bill exceeds this plan, then you will have to, pay the balance. However, the insurance company will cover up to 100,000 in this case.
So, you understand what she's saying?
Yes. Ebe no ti won che lo antinata no lo tun yi na. Arbi kami no magina, arbi kami no wa magizo no. Ewo en bukari no wa ko. Among ga bi agachi bukari onti. En ga be ke balance no to ga la debo.
For special baby care means for someone, people who give birth to prenatal babies or preterm baby, and the baby needs to be in the incubator or need a life support. We will cover this up to 2 days. After 2 days, the member will be responsible for that care.
Ke kabindo chani ga wanda cin biya mai lokacin tun wa mai a ga yi matan doci ya ga dula kun kala ba a su a donye da ari foguba ai konfu da ari a donye foguba da foguba don ko ana ke da soko
For primary care, cover like malaria, diarrhea, respiratory tract infection, This is covered on the plan. All you need to do is walk into the hospital, present your ID, speak to a doctor, and then the health insurance will cover this care.
Yes, I did type before. Looking or natural loss insurance pattern which is cover.
Malaria, typhoid, diarrhea, respiratory tract infection. All you need to do is to go to the hospital with your enrollment number and you see a consultant and you'll be treated. And it covers the entire treatment.
It's the malaria, is a tough one, is a debatant but no, without enrollment 6-digit number. Ngawa lalo hospital, ugala lalo hospital, ugale doctor, and do nga ka waiting na yo batana yo batana, yo won batana na yo nga bi which cover.
For immunization, we only cover meningitis for 6 years to 17 years on this policy. ICU, if someone needs to be in the intensive care unit, we only cover for 1 day, for 24 hours. After 24 hours, you will be responsible for the care. For
immunization, I mean, what you not maybe for Cambodia, egite problem with the intestine care unit. At the Katana, Katana Lagita, a chechuli, a luta the Nyobi, Gemajiana, a church one, I was up for 24 hours, a phone a one pattern which cover Ngabe again for Nini, and Nagabe Techuan or Toga, or that's one.
Okay,
Gigere Kawun. For Chetagi, what did I put in you? Yoko, the number the Gayabu Swano, Loya Way, give your Gubana, Ungawa cover. You don't know.
For evacuation from hospital to road, peradventure someone is involved in an accident, evacuation from hospital to road, from road to hospital, or from home to hospital, the HMO will be responsible for this.
There's an accident, I'll put the hospital, Pokma the Gambo, I'll put the hospital. HMO, NHS, Batam cover. No way, not for that.
And for dental cover, we will cover up to a limit of 5,000, meaning consultation and whatever. If you need to see a dentist and take care of your tooth, the HMO will only be responsible up to 20,000, up to 5,000. When it exceeds this limit, you will have to make the balance payment.
Organization no cover the double BL insurance double BL that is 5,000 don't Ngabe aganchi wani batani kon dem o to da la do de gan o ye da ke ati o catch BL nga go double BL gan o to ala no we na ke no.
For eye testing, we will cover your eye testing is fully covered by the health insurance.
The battery, I got Chibata, I got Puki, I got no way.
However, if you need to take classes, the HMO will cover up to 5,000 naira on this policy.
Why now? Chop any travel, double BR, guy and I cover, not going to go to another.
So for consultation for eyes and testing, it covers up to 5,000. Now when you want to get glasses, I think in some government hospitals, they charge about 10 to 15,000. We'll cover up to 5,000 from that amount. So the remaining 10,000 will be paid by the beneficiary.
Oye doctor eti yo no bichike eyo muchibata ilana wida ubiara unga ina atwa ba ile so awona last so awona muchu wadmo like 15,000 you know aya la no we 5,000 daga bago 15,000 no nga be ke bi goma na ke no twa ko ba yanto.
We don't cover eye surgeries. Eye surgeries is not covered on this plan.
So
I look to ya. I won now. Wow, we can't. I look to where ya. I now look to where you know to other where went to.
So actually, the foundation, like I said when I introduced this program, the foundation actually covers, assist or support patients, indigent patients who cannot afford to pay their medical bills. And like I stated, we supported over 150 women in paying their medical bills. We've paid for surgery for people. But because our foundation is not here in Abuja, we might not be able to extend that hand because we need some level of verification from the hospital. And commuting from Abuja to be that come and verify might be a bit difficult. So we don't cover this under the plan, but we have programs under the foundation that support patients that need this kind of surgery. But we are based in Abuja. We focus our support for these cases in Abuja.
Foundation ba no we neji temoko amaji zaji temoko da 1,500 150
Yes.
150 daga enzaji daga Abuja no temoko ya lotuye no daga na adi office de chiba bobana Abuja ba adi chono wa ye ja no ageza dan abono a lotuye a mashi Abuja no a bia bogan a dala na wiye uncha la ya so ala te kago tun acha ama adi temoko jidabo programs jidabo na ayeji kami ndochi ngabe afford don tun ayela na wiye bulano.
For ENT care, removal of foreign body, if someone has a situation where you have a foreign body in your ear, the health insurance will cover this care.
Ke bate tukpana obede yankuni tukpago awuwa ka insurance e ba na la unchi cover wala na we unchi la.
You understand that, right? Now,
Yes.
for any foreign, say something entered your ear, and for minor ear infection, the ear is paining you, and they confirm it's a minor ear infection, it will cover it. If anything drops into your ear, goes into your ear, the insurance company will cover the removal of that foreign body from the ear.
Ke tukbe tawa ni ga mai ena unyi ena tsanani saranya no ai la na we unchi tola. Kami ndochi aya dotukpo aga awuwa nchi bata ai la na we unchi toshida.
I have a question. ENT. Sometimes you have a very serious case that requires surgery because ear, nose, and throat are usually related.
Yes.
Now, are you able to cover that kind of surgery?
No, like we stated earlier, we don't cover major surgeries as that, but we can do that under other programs.
Okay.
Yes, so long as the person resides in Abuja, or we can verify the person's health condition, then we can intervene from there, but it's not under this insurance.
Let me interpret.
All right, you can use the mic for the sake of the video.
Hello. Hello. Wato, yanzu yi na kandoci ene deza tupo da robo to eyina etune lónìí láàjẹ tún mọ̀chúkwọ́ yẹn sọ́jẹ̀ ńláwọ̀ ẹ̀ná àgbáyé ẹ̀nà Kagwa na wona a ji soji ne amma ci samu shi ne dai taimako na ga jona ji amma kan doci a fin wobe zan doci nga ji ne soji ne to a ci nan a da ba ji samu shi taimako ka koyi
for ENT surgeries is part of your overall surgical limit, which is 100,000 if you have to have a surgery. So your ENT surgeries will be part of it.
I mean, what you can know, Jibani Banner, but 10 years soon. But to pay what you want, lava, Fingani Bioji, at the Carbonia 100,000. No cover.
So, for instance, remember I said it's not covered entirely. We've mentioned that the general surgical limit is 100,000. Say, for instance, you've not used it, you've not done a cesarean session, you still have 100,000 unused. Then they can use that for the ENT surgery. But if you have used it, you will not come and pay another 100,000 because you have already used it. Or whatsoever, if you have an amount left from your previous surgery, the general surgery, then we can use the balance to pay up for your ENT surgery. Whatever comes outside that balance, the person will take care of it.
I can't find but that my own situation. I go in a general to be in a big to pattern and jump to the
Also, on this policy, renal dialysis is not covered. However, health screening is covered for members on this plan.
So for this plan, renal dialysis, that is, if you have kidney disease, someone has kidney disease, it's not covered. But I want to use this medium to tell you that so far we've paid for renal dialysis for over 15 persons in Abuja, but not covered under the insurance. Like I said, we do health interventions, and we've supported over 150 persons, including men and women, children, because limited to women alone. So for renal dialysis, on my record, I have over 15 persons who have been supported to do their dialysis. But like we said, for the sake of this insurance, it does not cover. However, general screening, health screening, is covered under this insurance. Or for instance, you want to check your blood level, you want to check basic health related matters. But a doctor has to ask you. You have to tell the doctor you want to do that. He will write a note and you take it to the lab and they can run a general screening for you. Yes, and it's covered under the insurance.
Zaneji Batanya kidney na not to support the ban cover young chitwa. Ama ke ajo test wa go pe wo de batem to wa go wo ji test ke a check ya wo hi a ji de wa junchi no to unga unchi to cover. Ama a ji temoko ya dialysis ya the problem ya kidney na gun za go gun de dan ba chun go ba na re ko go gun za go ya ni bot ba gi benzagi ama uchi ke mun gan shi boye na ko go abuwa ati support no chi ya de health support program no chi nga na kugwa be yin ati jun chi no ama no to nko ba mu chi ta ama de test wa gi chi data ngo ko ko
BMI, urinalysis, and blood pressure. So peradventure you want to have a health screening done, you can reach out to our team. We have designated centers where this can be done. They can check this for you.
Ke wa di test yan ke bori ya ni ga no ke choda ois urinalysis and what again
And blood test, I can take it back.
ke
Policy does not cover cancer care.
ke wa di test yan urinalysis e bori ya ni no ke physical check up no a chuan ye ke no gi kin no be ye e jahi bata ai de temoko e bu wa ko la attention ya e te na ya de ba no za ne ja àjọ àtàgbàyàwó bọ́ọ̀lù ìbá àjọ tẹ̀sí náà yìí náà kí pàtẹ́ kánsà yá yìí náà mo ti tó yìí bá dá mo ti dán coverage yẹn wà ń dán náà wà.
You have a total limit of 250,000 naira to be covered on this plan.
I did 250,000.
Yes, to be covered on this plan.
Would the review that?
Like energy between I did that support to 250,000
For each
yeah, it's like in do no.
This plan also covers outpatient psychiatry, meaning if someone needs to see a psychiatric, we can cover up to 2 weeks of consultation.
Kids are regarding the battery, you know. No, we are start to go back.
We do not cover inpatient psychiatry on this policy.
It's covered, but they don't cover inpatient, that is on admission.
So, another kata, ya battery if you didn't know. Sana ibata ayin la kakulung chizo ama luye de battery de begina ya chiwaga space ama wa changa abego genjo muchi bata yuko ama kana katani eti battery if you know ayin la kakulung chizo.
Also, you can have an AXA doctor callback. This is covered on this policy.
An AXA doctor callback, that is, you can call a doctor in AXA Mansard Insurance. The name of the insurance company is AXA Mansard.
AXA Mansard?
Yes, AXA Mansard.
Okay, AXA Mansard.
Yes, Mansard. Sad. So, you can call his doctor, and the doctor can give you an online consultation.
Okay.
Yes.
At the program, it's AXA Mansard. When you don't go,
We also have our telemedicine service. All you need to do is download the My AXA Plus app, register with your ID, and you can chat with the doctor on that platform.
So I have an AXA Mansard app. I'm going to give the name of the app after the voice note. They can chat with the doctor, the life doctor. There's someone online that can even chat with on your health matter, and the person will advise you where to go to and how you can go about that health-related issue.
As a man, at the app, the phone, the wire, link, you got download the app, the wire, what Bazaobi. Doctor, but go in the gauge on the mono. Why I was shower in the way, Rogino, Basil, or Tuno, Ngasa, link, they got the wire, Chukono, root and load so that we come into Ungati, a challenge in Ungati, Matala, one Bazabu, through chatting.
So, for some of us who do not like to visit the hospital, you can chat with the doctor on that platform. So this is basically what this policy covers, and we'll take questions if there are any. Thank you.
So two app no wo as I would up to it and engage on that one guy Matala no one the Pano Galo no General Gajina be Achimo Pana Energy Program no cover fata no gata iti by new ban no Santo today ngadi can be no unu the garo be a question.
Okay, thank you all for listening. Thank you so much. Okay, now I'm going to insurance is AXA Mansard, and I'm going to also explain the first thing you should do when you get to the hospital. For instance, you are sick or you have headache. Okay.
Che number ya app which no go alive number is and no go up as I hope you two if you know two wire no la number which you got no I mean do ga de matala wa go last speaker wa paza bi ko wa call ma wa chat bi wo ji bayan ni ne ke ji wa da no so da ya wo shawa ano ga lo no bi ne ga ku wo ji no.
Now, the first thing you should do when you get to the hospital, I'll take my time to explain this because we have implemented this project in other places, and I think a lot of people still find it difficult to assess it because we don't know the first thing to do. I'll still explain now. When you go to the hospital first and you meet the receptionist, the first thing you should do is, I am from Ismaila Foundation, and I want to see the doctor under the health insurance, AXA Mansa.
Then on we will go to hospital, Kevin or Gigino. We'll go to hospital. We'll go to no GA, we'll go to no Lawu, that no go to reception. Here we will pay the insurance and no AXA Minor Foundation, AXA Mansa. Insurance.
Okay, they will ask you the name of the insurance. Then you mention AXA Mansa Insurance.
And you also know Babu will build the guy, Babu will build. Search you, they make sure I don't look when they appear. I don't like to go to you. We're going to attend you. No, to buy no cars and buy no chicken.
Okay. So that brings us to the end of this program. So if you have any question, you can ask. You can ask in English, you can ask in Dupi. He's here to interpret.
So, program no. Other bits are the minimum nga nyo de mi na sarang king mai de no pio you know you ebe na get to down.
Okay, so we'd like to take the first question.
Zide ga pio
They don't ask, I will ask.
age big down where big guy
Okay.
other people
No.
that is our question.
No.
So no we use who are 20 that cho ga no ma uni nang jang fa no.
So this is not
They
the
will not be able I hear what it is. They want the Babobo in the Babobo from Tomania and what do you?
This is not a family insurance, this is an individual insurance. It's just for you. And your
Insurance,
child.
Mutinya Padia is in Guyo. See the one of the Babobo.
Okay.
What about the postnatal?
It's not covered. It's not stated yet. Can you ask so that everybody will benefit?
See, Mama Yalla, Zanaga did, you know, Wagan, you want to know what I'm trying to say, anybody that asks questions to mention his name for your record.
Exactly.
The introduction is matters enough.
Yes. Okay. Okay. She can start it. Maybe.
Yeah, well, that was because she bought a fan. Yeah, when the doctor she bought it, you are.
Our question is, she has been visiting doctor before. What happened to her? She's been seeing a doctor.
Okay. If you've been seeing a doctor, like I said, we will give out the list. I'll give it to you, sir. You find the link to. We have list of hospitals in Mina. In fact, this insurance is not limited just when you're in Mina. You can access this insurance anywhere in Nigeria. Anywhere. You decide to go to Abuja, in Abuja we have a lot of hospitals. In Bida, I think we have about say 3 hospitals here. And then, but in Niger State, so far we have about 15 hospitals here in Niger State. So if you don't like any hospital in Bida, you can go to Mina. You can go, if you're in Abuja, you can access medical service there. You can go to National Hospital and all of that. It's a lot of, if I decide to print all the hospital, it will take about 57 pages. And all of you cannot have, but I will send the soft copy to the Honorable Vice Chairman, so that through him you can access all the hospitals anywhere in Nigeria. But for her, who is already visiting a hospital, if you're comfortable with that, you can continue. Okay, and if you want to switch, if you like the hospitals under the insurance, you can please use it because it has been paid for. Whether you use it or not, the insurance company will not refund us the money. So we encourage you to use it, okay, utilize the money. Group of people, sponsors have paid this amount for you, okay, for all of you to have access to this medical service. So we advise you use it. But if you're comfortable, maybe you have a special health matter that the insurance cannot cover, you can go ahead and use the hospital you can use. That's okay too.
Okay, let me just do something. The question you said now is we are here just because of less privilege. So the issue of whether you are visiting another doctor or not, this is very important because this program all about to help the people that are not so buoyant enough. So where she's using before, she can automatically switch to the hospital that the NHIS will mention now, which is important.
Exactly. If it's not a chronic matter, like I mentioned, because if she moves, if her situation is something the insurance will not or does not cover, she doesn't have to move. That's what I stated earlier. So that she doesn't move there and then go there and it's not covered. And that's why we took our time to mention all the health benefits that the insurance covers. So if your situation is covered under the insurance, you can switch immediately to the hospital and you'll be receiving your treatment for free without paying.
Yes, my question is, we already have an existing NHIS.
Okay.
Now, how do you integrate this foundation with the existing NHIS?
Okay. So, I don't know if any of you here are under any insurance, you have to state it. Because, you can't integrate insurance into another insurance. It doesn't work. It stands on its, all of them stands on its own, and they have various hospitals they work with. So, I think that's what we need to also sort out here. For those who were registered, we ensured that they are not registered under any, except you don't like your insurance company, then you can switch. Okay, when you go, you can say, okay, I'm now under AXA Mansard, and they will treat you under AXA Mansard, Ms. Maynard Foundation. But you cannot receive treatment under another NHIS and expect that Ms. Maynard Foundation will pay. No. Okay, so if you have an existing insurance, please just and you want to continue, let me know. We'll take out your name from here, or we continue. Yes.
Salaam alaikum. As an enemy, Mina, Mega NHIS Mungo Shibuan, Yazando Chiji. They got the NHIS or Shibuana Kionwan, Lula Finna, Jina Ndola Nikinyu, Elo Kadoya. They got the NHIS on Kakadeu Muchimpobia, Mulano. Amount to go Muchi, Emo Fabio Muchi, Mulabu Muchi. There was a name of when you want to Kandochi or Bello, as I the NHIS Uba, or the insurance Uba, who Labo Sunana, who Labo Suna. So,
the enrollment number one, Bando the party Nigeria was since 8 years. The asibiti titaji the mini ejijo naji wolo no ndi asibiti bata walo kevida abono na asibiti wita ngo lo kemi no na ade ke yogwe no fibo atiga bando ga the party Nigeria no wolo asibiti wa ma ade asibiti sitachi no bago no walo ja use enrollment no
My name is Aisha. My question is that, as you said, as I have problem of kidney.
Okay.
So my problem of kidney, I say the best I say that anybody that has problem of kidney, as me now, will I be able to diagnose the have? Or you say people are not proper about the kidney problems?
Okay. Okay. So I want to know what level of kidney is it kidney disease you have? Kidney stone. Are you taking any medication? Okay. Now we said that for renal dialysis is not covered, but you can go since it's not dialysis. Dialysis is different from having kidney stone. You are just taking medication, right? So you go to the hospital and tell a general doctor about it. This particular one is under the insurance. And mention it, they will give you drugs. They will give you drugs. It's not, that's why we say other chronic diseases that require you to take drugs on monthly basis. You take your drugs monthly, right? Yes, you've been able to. You've not been able to buy. So go to the hospital, they will give you drugs. If they don't, just let me know. Yes. But for dialysis, we don't cover. Dialysis means it's kidney disease. Yours is not kidney disease, it's just kidney stone. Okay. Alright. Okay.
Ni da nake mina yanzu jikina ya yi san ba lafiya kuma ban da karfi da zan shigo motar zuwa nan zan iya zuwa kowane asibiti.
Help me ask.
From Mina. Can she visit any hospital at Mina?
Yes, I mentioned it earlier. You can visit hospitals.
That is what she says. See, what she's saying is that I hear.
Yes.
She said she's in Mina. So long maybe maybe when she's at home, and she will not be able to go to hospital. You don't have power to go to hospital. Can someone go for her at Mina?
Nobody can go to the hospital for you and see the doctor. It's not possible.
Who's that?
We see these are the hospital lists. If you want this call now, it's going to in Mina, in Peter, in Suleja. We have in Kotongora, we have in Yubusa.
They want to know that you are living
Vida. Okay. The ones in Vida are.
We are talking about this Vida.
Maraba Clinic and Maternity Home. Maraba. Permit my pronunciation.
Okay.
We also have Asman Hospital.
Which one?
Sule Firehouse.
Okay.
Kotaworo.
Fire.
Asibiti na chiba go. Asibiti aja na
Then there's Primary Healthcare Center. I don't know where that is, but they did not include it, but I was informed that there's Primary Healthcare Center.
We have a lot of primary cares in Bida. There are more than 20. So which one?
I will get the address for that particular one and share with you. Then we have for Mina, those that are in Mina, we have Standard Hospital. We have Divine Faith Medical Clinic. We have Acmedics Hospital. We have General Hospital, Mokwa, Niger State, Mina. We have Al-Aziz Medical Center, Kotongora. We have Maraba, right, as I mentioned. Then we have Hygiene Medical Center, Yubusa. Then we have Top Medical Center, Tunga, Mina. We have Savannah Hospital. Savannah is a very good hospital. Also in Mina, around the Mina Road. Then we have the ones in Suleja, Mark Care Hospital, Suleja. We have Suzanne Memorial Clinic and Maternity, Suleja. We have very Specialist Hospital. We have Citizen Hospital, Suleja. We have Fari Group Clinic, in Suleja. We have Spring Valley Hospital Limited. We have TK Hospital Limited. We have Great Birth Hospital, Standard Hospital, and so on and so forth. So these are the hospitals under our insurance. Like I said, it's not all the states that have hospitals for dental issues or optical issues, that is eye and ANT. So whichever one you prefer to go to, you can go to. Even if you travel to Ogun State or Lagos State, it doesn't limit you from accessing medical services. All you need to do is to present your enrollment number, and you can call me to ask which of the hospitals can you go to in whatever state you are in, and I will look at the hospitals and tell you. That's all you need. So whether you're in Bida or not, you can access the service. If you don't like the hospitals you mentioned, you can go to Mina and access the service, or you can go to anywhere that's close by. I don't know what.
Sorry, before.
Follow the enrollment number in do giga in engaging with Amuano. Ogabe Oga Nakin Jabo Jida Shindochi, or Maki Aspit in Lona, or may what Amuana Combo, or you know by Baunto, go there she comes on. Waka o asibiti o mo iwoda ama waka o asibiti no ka queen o lono mini shi mucho no o ba ni
na he confusion ke wana aga na prescription FMC bono la do ata wo ko waka doctor ka chi bia wo la do ata wo ko waka yesi ticket number ne
Azumi, she went to FMC, Federal Medical Center, and they prescribed a drug for him. Can you go to those hospitals that are covered by this this program and collect the
okay now because FMC is not under our health insurance? That is where you will now call the customer service and show your prescription. After Mansard will cover it. After Mansard Pharmacy, online pharmacy will cover it. They will purchase the drug for you and give it to you because it's under your insurance. Okay, for the hospital, FMC is not under the insurance.
I didn't get no solution very well.
It's not right.
Now, if you go to FMC for prescription, okay, they will ask you which of the hospitals. FMC is not under our insurance, okay? So you will need to call the online doctor. They won't give you any drug under insurance in FMC. Okay. So you need to call the online doctor. That's the pharmacy. The number that I will send to all the women. Then they will get the drugs using the prescription from a doctor. Okay. Yes, and deliver the drugs to her.
Wogabe do FMC kim no giga na chi prescribe chi biawe daga na FMC Maina Foundation ko fa wana asamasa un ko fa wana wada online pharmacy daga online pharmacy oga kenya ato beti anya aka chi be no shi ala dawe mbo ano oga de no.
Any other questions? Okay, I should repeat. I think in the introduction I mentioned it. I said the insurance covers for 1 year. Okay? If you see how you respond to going to the hospital and receiving your basic services, we will get a report from the insurance company. When we see the response, that will encourage us to maybe renew. But we are not promising you that we are going to renew after 1 year. But there is probability that we will renew when we see the response.
Program no eya dikuyo ama aya chechi tupa bi daleshi asibiti no ja aga ekem na dasin piano ame lotu ayekem ngwe no muncha ya ada no battery aniga wo muchiga so mucha aga ye ga no ba sara mucha ya dama no aya na wo bia wo na ya bi no muchiga ya dama ma aja ni ko ni no nga so aga aja ma bia chi ya ga ji mi chi ge na yung ji ya muchiga ya dama na
hospital ní ṣe àgán describe ṣàfihàn náà ọ̀gá tẹ́ta fún àgá àdìskáìní ṣe mọ́ra àbáwọn ṣùgbọ́n ń dáná àtìgbò òdo diskáìní mọ́tò mọ́ra àbáwọ̀ àná àtìgbò òdo àtìgbò tí ó tó òdo diskáìní náà ṣe wà àdìjí náà ẹwọ́ mọ́tò kó òdo àdìjí. ìgbẹ́jà síbi kúkà náà àgá describe ṣàfihàn ọ̀gá tẹ́ta àgán fún àdìskáìní wọ́ ètò ìṣèlú mọ́tò àtìgbò wà.
We went to those hospitals and they said they did the scan and they don't have scanning machine in those hospitals. What are they going to do?
These hospitals have been reviewed by the health insurance and they have scanning machines for your basic health issues. Do you understand? So this hospital was not just picked from the internet. AXA Mansard have an agreement with the hospital and the kind of services they can provide for you, basic health issues. And that's why I mentioned earlier that it's not all hospitals that have dental aspect. When you see these basic ones, your scanning, hematology tests, lab tests, these hospitals run those tests and the scan. So you have nothing to worry about.
Energy, I make sure I do Kokarina energy, Muta hospital, which you do, that I've been at the hospital, so I do the corner, don't you if you ask me to.
Do we have more questions? No, okay. Now you have said no. When you go to the hospital, what will you do first? When you go to the hospital to see a doctor, what will you do first?
Hospital,
she visited the hospital, she will tell them that she came from other massage. From there, you will now tell them that this is her security enrollment number.
Okay, let's clap for her. All right, so I want to give women going to enjoy from this insurance. What is this insurance going to give to you? What are the benefits of this insurance? Any woman can let her answer.
Your name, tell us. My name is Aisha So I joined the ASAM. I learned many things with you. Because we're talking about the tablet, we shouldn't go to any pharmacy and go and buy the tablet. So it's a good advice. I'm very grateful about that.
So now you can now go to the hospital,
yes,
right? Take the doctor's consent first, and then.
I'm enjoying the advice. Thank you.
All right. Thank you. Thank you. That's why. Any other contribution? Is there anything that you've learned? Give us maybe your appreciation message to Miss Maina Foundation. If you have anything to say, Miss Maina Foundation.
Miss. Who is Maina? Who is Maina?
Who is Maina?
Or who is the owner of the foundation, please? And who is Miss Maina, please?
She is the owner of the foundation.
That's going around in circles.
Yes, sir. That's all you have to do about that.
You know what?
Yes, sir.
We are aware Maina Foundation, Miss Maina was one time a minister.
Okay.
And I don't know if she's still alive.
Our popular name is Aisha Maina.
Really?
Yes.
Okay.
Okay, sorry.
This is why they
And minor foundation. Zimba ya chonto. The Jitimoko and Ghana. When they like me about boy. You know, like me, Pandora, and the Bolo Tubo. Among any when he been minor foundation side. You might be any about boy. I just said that we try to find out who is minor. And you to the answer back to us as minor is minor. Was that okay? Because we here we love to pray for any good work.
Yes.
Now, if we pray for her, to God be the glory.
Yes.
So we should get the blessing from the beneficiaries.
Yes.
That's why I'm asking.
Yes, you can pray for the foundation. We prayed for her.
Okay, I pray for you too.
And Miss Mena foundation. Miss Mena is alive. She's healthy.
Oh, thank God.
And she doesn't like public.
We pray for Esther too.
Okay, so we'll give you opportunity to speak. So let the women share or give their appreciation.
My name is Aisha. I'm here to appreciate all the team. Because this Miss Aisha Maina, the woman, all what she's doing, maybe she doesn't know how, maybe, okay, that's actually the Tamako, and the value of Tamako, say, there's an innovation. So, if you have the Tamako, and the idea, there's a few is able. They are there for long, looking for help, and the opportunity comes but once. So for Mola, so in Jerusalem, they should be blessed beyond her expectation. Thank you.
Okay, she's appreciating the minor foundation. She said, "This is an."
This one is here, the one is like a national Marcane or Klein, Sumabuta, Allah, I don't have blessed now one that
She went ahead and also appreciate Minor Foundation. She prayed for Minor Foundation to continue prosper and to continue elevate. That is what she said.
Assalamu alaikum jama'i. Gaskiya ina ya fai sarani kuma ke ruwe a chagoro da ana mujiza ya ji kayan bi mu fara na goge a daga na yanzu fero na na riga da ba da tsoro ya ke bidebe wato foundation doro ina ya chanaga da wani ndochi ma feju ya be kanze je so chuna be da bobia wanda bo fero ye ba soko o da chemo kwawo ye burulu na labe na e mana de to sai na ga lutun nawo so yi gida waye daji ya sarani su koma wa ba na dokuna my lady Mother Esther, when I just said a few words, I said foundations like this may be started at a point in time, and many a times it outlived even those that started it. And these are the first beneficiaries from BIDA. It doesn't mean that it's going to stop here. Others may benefit in the subsequent years. And then use the opportunity to appreciate the foundation, and especially people like you who have taken the mantra of pushing this thing forward, because it takes a dedicated person to actualize this kind of feat. Our able vice chairman, he's done a good job amongst the good jobs that he's been doing, and I know that the future will be better for Nupeland. Thank you very much. We appreciate it.
I want to thank all of you for coming out, taking out your time, giving your businesses to come here today. Trust me, without your presence here, this event would not go. I want to sincerely appreciate you all for coming, and we are hopeful that you all will utilize this insurance, as we have bought it already for you all. And in order for this our goal to be fully achieved, we encourage you to utilize it. Okay, avoid self-medication and drug abuse by going to the hospital, seek doctor's advice before you take any medication. All right, and I want to also sincerely use this opportunity to thank all our sponsors who are giving out their resources to ensure that 440 women are enrolled in Nigeria, and to give them free access to basic medical services. And so far we have enrolled 208 women. We appreciate our sponsors sincerely, and we hope that we can further discuss with more resources by God's grace. Thank you all, and God bless.
I said, may God bless this gathering. Amen. And let everybody get back to destination safely. سبحانك لا إله إلا أنت يا بديع السماوات والأرض يا ذو الجلال والإكرام يا حي يا قيوم يا حي يا قيوم يا حي يا قيوم إننا أسألك سبحان ربك رب العزة عما يصفون والسلام على المرسلين الحمد لله رب العالمين.
Can interview one or two persons from the women. You have an interview from them.
Yes, we did. English or
they can speak, we don't need interpretation. They can speak, but those who can speak English, please let's use one person that can speak English and one person. Okay, yes, you can call her after. Okay. Okay, my name is Esther Chukwuma. I am the program officer for Miss Maina Foundation, and we are here in Niger State, PIDA, particularly to launch the Empowering Women's Health Initiative for women. And this program was established to commemorate the past International Women's Day. And the focus of the program is to give basic medical services to women, free basic medical services to women. And one of the reasons we decided to initiate this program is to prevent self-medication and drug abuse, which is prevalent among Nigerians. So our focus is women this time around, and we want to seize this opportunity to appreciate all sponsors who gave their resources to ensure that 440 women are enrolled into this initiative. So far we have launched this initiative in Lagos, in Abuja, Kefi, and now in Niger State. And we have in total enrolled 208 women in this state, and we intend to reach out to other states as well. So I want to appreciate everybody who came together to ensure that this program is a success. I want to appreciate the founder of the organization. I want to thank everyone. In fact, I don't want to begin to mention everything I do. We might not end or go today, but so I just want to thank everybody who made it possible for us to organize this event in Niger State today. Thank you so much.
Vice Chairman, BIDA Local Government, Neto Kodin Yakin. Honestly speaking, it is a great opportunity to us in Niger State, especially Bida, particularly because this Empowering Women's Health Initiative is a program that people have been bringing it on the side of other, but I think this one is one of the best and I see so far. Because we have our women here, we have less privilege and widows that are here that they cannot be able to attach the money to buy goods. So with this health insurance scheme, it will make those who are in this problem to solve whatever they want to do. So I think it's a good news to everybody that attended event.
Your appreciation.
So my appreciation goes to the Minor Foundation and myself entirely because I collaborate with the minor and I told them that I think we need this in Bida. So when they answered me and they listened to me, and I brought the program to Bida, which today we all benefit over
Introduce yourself. Good afternoon, sir. Thanks, sir. It's a pleasure to see you, sir. My name is Esther Chukuma from the Smena Foundation. Esther, so we came here in Bida to launch a health initiative program focused on giving women basic health, access to basic health facility care in Bida. And so far we have enrolled 208 women in Nigeria, basically in Lagos, Abuja, Nasarawa State, and now in Niger. We intend to also spread this across other states based on the resources available in our hands. So today we have launched the program successfully here in Vida, and we hope that immediately the women can begin to use the health insurance that have been created by the organization. Our organization is actually established on October 13th, 2021, and our goal is to enhance the health of women and Nigerians in terms of providing medical services through our various programs. So we give out drugs to people living with thyroid disease. We have done that to about 350 persons, and we have also paid medical bills for over 150 persons in Nigeria. Yes, so that's basically what we do. And we are really privileged to be here. Courtesy of the Vice Local Government Chairman said we should come and pay a courtesy visit to the area. Thank you so much, sir. Thank you so much. Follow through, sir.